well, welcome everybody. My name is Jordan. I'm one of the physical therapists here. Those who haven't met me, I'm also the clinic director here at Home and Rehab as well. So today, of course, we're going to go over dry needling and what it is, kind of go over the comparison, acupuncture, dry needling, and things like that. Of course, answer any questions that you guys may have, and then we'll go from there. Alex is my PT student. He's a student at St. Augustine. So I'm going to demonstrate just briefly what that looks like. And then, of course, like I said, if you guys have questions, ask away. All right. So a little bit about me. Born and raised in Tampa. I did my undergrad at University of Central Florida here in Orlando. I did my DPT degree at Nova Southeastern University. I've been a PT for about 7 years. I'm board certified in orthopedics. I also have my dry needling certification as well, of course. And then I've worked in mostly an outpatient setting, but I've also done the acute care setting, oncology as well. And then I do adjunct faculty at Nova Southeastern, the hybrid program over in Tampa. And I enjoy basketball, golf, and traveling like that. All right. So agenda for today, like I mentioned, what is dry needling? Dry needling versus acupuncture. Discuss the benefits of dry needling. Conditions treated, what to expect, what does it feel like, and then the aftercare. So what is dry needling? Dry needling is a therapeutic technique performed by a licensed professional in which a thin sterile needle is inserted into a tight or dysfunctional tissue, muscle tissue, and called what we call trigger points or knots. Okay. So with that, I'll go into a little bit more detail a little bit later on in terms of like what happens when the needle is inserted. But just kind of a brief overview. Obviously, we use a very thin needle. We penetrate the skin, go into the muscle belly itself. So we're targeting the specific tissue in that area. Blood flow obviously comes into play. We need blood flow for tissue healing. So whenever we insert the needle, the idea is to help with blood flow to that area, bring in oxygen for the tissue to heal as well. When we insert it into a taut band or a trigger point, the idea is also to release the tissue, any tension in that area, kind of get the muscles to relax. And obviously, from a physiologic standpoint, it's very, very detailed, very, very complex situation that happens, more than what I would explain right now. But the overall broad purpose is blood flow to the area for healing, relax the muscles, release any tissue that's taut, whether it's a trigger point, fascial restrictions, things like that. And then, again, we'll talk about it a little bit too, but soreness may happen almost like if you did a workout. Some people get that delayed onset of soreness afterwards, okay? So dry needling versus acupuncture. Has anyone had dry needling before? You've had it before, okay, so you're familiar with it. And has anyone had acupuncture? Okay, so different, but similar in a sense that we use a very thin needle for both. Dry needling, the term dry, obviously we're not administering any medication, anything like that, so it's just a dry sterile needle. Acupuncture, same thing, not really administering any medication. However, dry needling based on modern anatomy and muscle science, acupuncture based on traditional Chinese medicine. With dry needling, like I mentioned, we focus on muscles, trigger points, and movement problems. With acupuncture, it focuses on more energy flow and meridian points throughout the body. With dry needling, often used to treat muscle tightness, pain, and movement irritations or limitations. And then with acupuncture, used to treat a wide variety of conditions, including like pain, stress, a little bit more systemic. So think about things like migraines or someone that has GI issues, maybe issues with fertility, things like that. Dry needling, we're not really going to focus on that as much as with acupuncture. Treatment area is chosen based off of the pain, location, and movement we're testing, whereas acupuncture treatment points are chosen based off of meridian pathways. Those meridian points on the body are very specific, so that's why, just for example, maybe if you're having headaches or migraines, if you saw an acupuncturist, they may not have needles specifically in that area. They may also have some points in the hand, the foot, based off of where those meridian pathways go. Okay, with dry needling, we're pretty much localized in that area. And then short-term use to support rehab and recovery for dry needling. With acupuncture, may be used as an ongoing preventative care. All right, benefits of dry needling. Of course, we want to target muscle tension, trigger points, pain, movement and range of motion, promote blood flow. Like I said, blood flow is going to be important for healing. and then helps restore muscle activation. You can also use dry needling for scar tissue. If someone's had surgery, every now and then we'll use it for scar tissue underneath a incision or a scar. Obviously, we don't do that early on. It's kind of the later phases when the scar has healed or the tissue has healed after a surgery. But the needle itself is a little bit different than our traditional needle. It's more of a dull needle, and we use multiple different needles underneath. So, Mary, you mind I use, for example, so kind of the incision along the knee, I would have about 10 different needles on each side along the length of the scar, and we use like a winding technique to wind up the tissue and kind of break up some of it is pretty painful. I don't do it very often. Most people hate it, but it is beneficial after. So we can use it for scar tissue development. We just don't use it as often. Okay. All right. So referred pain patterns. Essentially, dry needling, we don't always target the area that you're feeling pain. Meaning, if you can kind of see the illustration here where it's red, if I were to just push, say you came in, you said, I have pain in my wrist. If I were to just push here, yes, you may have symptoms. However, we may also have the trigger point that's higher up. Referred pain is just another area of the body where the pain is originating, okay? So I may push on your forearm, and that may elicit the same pain that you're getting lower down in the forearm. Meaning, with needling, I'm not always just going to go straight to the source. I also may have to go above that segment to see, is it something truly else underlying that's causing some of the symptoms here, which would be referred pain. And the reason being is the nerves in the body share common pathways to the brain. So it's not always going to be in that area where it's highlighted red. Same thing if you think about tension headaches or migraines. I may be treating muscles in the back of your neck, but I also may be treating muscles in your shoulders because of where the pain may refer, okay? We have referred pain pretty much anywhere in the body. We have referred pain from the glute muscles. We have referred pain from our rotator cuff muscles. So anywhere in the body we can have referred pain. Now, do we get it all the time? Not necessarily, but it's just one of those things to think of where if I'm needling somebody, you may say my pain is here, but if I go in a different area, I may say, let's try this area, this spot above to see what else is going on, or below. Also too, so what I was mentioning here, this slide here, it basically goes over trigger points or knots in a muscle. Now this is a very large illustration. In the body, we have muscle fibers that interlink. When the muscles contract, obviously they cross, and when we relax the muscle, they come across, or they spread out a little bit. If we have a knot or a trigger point, it doesn't allow the tissue to slide and glide properly like it should, okay? So whenever we have an injury, so whenever we have an injury, that's why we want to sometimes do a trigger point release or massage to see, can we calm down some of the tissue? And then obviously dry needling is another adjunct that we can use to get that to respond as well. Again, same thing, it could be any type of pain that we're experiencing. If our body's in pain, the muscles may not be contracting like we want them to. So typically after surgeries and things like that, the muscles in the quad may get weak. So we target some soft tissue. Obviously we want to promote blood flow to the area, get the swelling down. Over time, some people can develop knots and trigger points, so those muscles may not contract like we want them. So that's where dry needling and stuff would come into play. Conditions that we treat: neck pain, tension headaches, low back pain, sciatic pain, shoulder pain including rotator cuff dysfunction, tendon-related pain, tennis elbow, patellar tendinopathy, hip and gluteal pain, knee pain, myofascial pain syndrome, and post-cervical. There's other, so I don't treat necessarily the facial muscles, the feet and the hands. That is a little bit more extensive of a training. Also the pelvic floor muscles, that's a little bit more extensive of a training. But everything else in the body we can target. So from the shoulders, hips, knees, ankles, and things like that. All right. What to expect during treatment. So of course, we're gonna clean the skin, prep the area and the tissue. I'm going to palpate through the muscle. That essentially just means pushing through the muscle tissue to see where your symptoms are coming from. Insertion of the thin needle, sterile needle. There's always a potential for a muscle twitch response, which may be felt. I always tell patients not to be alarmed when that happens. It's basically just a reflex that happens in the body, and the goal is to help calm that muscle down. So some people have a lot of twitches, some people don't have any twitches at all. Just because we don't have a twitch does not mean that the muscle is not responding or the treatment's not effective. Okay? A lot of times people carry their tension in the shoulders or the upper trap. So you'll typically see quite a bit of twitching that happens on most people in the upper trap area, just because that's where we carry a lot of our stress and our tension. There's various techniques that can be used, such as a pistoning technique, where we go into the tissue and I'm moving the needle up and down. You'll kind of feel me moving it in different directions, or a leave-in method where the tissue, I'm using multiple needles and we're just leaving the needles inside the tissue. Now, there's two different sides to it. The pistoning technique, people tend to get a little bit more sore because we're doing a lot more spots than usual. The leave-in method, usually people like a little bit more because they're not as sore afterwards. So if I'm just starting out with the patient, sometimes I'll do the leave-in method to see how your body responds, and then afterwards you're like, oh, I felt pretty good. We can always do a little bit more aggressive with the pistoning technique. Okay. Both methods are just as good. Obviously, we'll remove the needles, skin inspection again, and then pressure applied to the tissue, meaning sometimes people will have a little bit of bleeding. We'll apply pressure to the tissue to stop that, and then we'll reapply the needles as needed. Sometimes people will get bruising afterwards. That's typically it would be very mild bruising, but we don't use it on patients that are on like heavy blood thinners. Obviously, we don't want to cause more bleeding. We don't want to cause more damage to the tissue. So if you're on, like I said, heavy blood thinners, then we take that in consideration. Women that are pregnant, obviously we don't want to be around the abdomen region. It's not a true contraindication. Obviously, if we did it lower down in the body and things like that, it's a relative, but we take it in consideration. People that are immunocompromised, obviously whenever we're inserting the needle, though it's sterile, we're breaking the barrier in the skin, so that just increases the risk of potential infection if someone is immunocompromised. So we take all those things into consideration when we are using a needle. Now, if somebody's on a baby aspirin, something like that, I may test the skin just to see how your blood clots and everything. If you do happen to bleed, how quickly it clots. But most people do fine if it's just a small dose of like a baby aspirin or something like that. And then go over what dry needling isn't. I usually tell people, some people is like, oh, it's a quick fix. It's not always a quick fix. Now, I have had patients that come in and they're like, man, I feel great. I feel like I can do anything I want to do. And then I have another end of the spectrum where it's like, obviously we have to do more sessions than just one. But you get the most bang for your buck when you're doing dry needling in combination with physical therapy. So I very rarely have just dry needling alone. I usually encourage, hey, do a little bit of stretching, do some strengthening exercises in combination with the needling. The reason I say that is everyone has trigger points in our body. Some that we know about, some that we don't know about until I apply pressure or press on that area. And when we have that, it's no different than, say, if you're working behind a desk. What happened? What caused those trigger points in the first place? If I just dry needled and you went back to that same thing and I didn't actually treat the underlying problem or the condition, then most likely those knots and trigger points are going to come right back. So it's like this reoccurring of, I have to treat it, come back. I have to treat it, come back. So that's why we still encourage, hey, I still want you to stretch. I still want you to focus on these exercises, these strengthening exercises, before you come back and get another session. Okay? And then aftercare, of course, you want to move and stretch normally. Drink plenty of water. Light soreness is expected. Typically, I tell people avoid immediate use of ice and heat. We want the needling to work itself. And then best results are, like I mentioned, when combined with physical therapy itself. That's one aftercare. I've had some patients, this is rare, but some people will get numbness and tingling, which again, that should not happen. If that's the case, this is more during, and if you do get like numbness and tingling in the area, that can indicate that we're on a nerve. Not the end of the world, we come off of that area. It's not like someone will have nerve damage from pressing on that. Now, of course, if I were to sit there and up and down on a nerve, that's not a good thing. That's not what we want. That could potentially cause harm to a nerve. But if you just feel like what we call like almost like a zinger, or it's like, man, I feel this. We come off of that area, put it in another spot, or reinsert into a different area. And then that's the main thing. Before we go into demonstration, any questions that I can answer right off the bat?
Yeah, you mentioned something. Someone is on blood thinner,
Yes.
and you don't particularly suggest it or
Now-
recommend it.
Yes. Now it's not. We take it with a grain of salt because it also depends on how well your blood clots. So if you're one where it clots really slowly or you bruise really easily, I would still test the area of the skin to see how your body responds. Again, it's a very thin needle. It's different than a needle that you would go to your doctor and get an injection, things like that. So the needle is very, very thin, but we still want to take that in consideration in the event that you have a lot of bleeding in the area after the needling and things of that sort. So again, it depends on how many medications you're on. Like if you're bruising, if you bruise very, very easily, and how your body would respond to like just a prick, and then we see what your body does in that case.
Mm-hmm. What about if someone is like my husband has this device, because he had AFib. It's not what do you call that thing? I forgot.
Pacemaker?
It's not pacemaker, but it's just
Is it just an implant? Like a
no, it's just under the skin, you know, and just to monitor his heartbeat and all that.
Okay.
So
Yeah, so we can still do needling. Obviously, we're not going to needle in the area where any implants are, things like that. But if it were something more distal down the arm, in the leg area, we can. Again, we would just have to stay away from that area.
yeah, but then because he has that, because my daughter my daughter-in-law is a nurse, and she was saying check on it very carefully because dad may be getting bruises, all
Right.
around.
Right.
So which you mentioned.
Yes, yeah. So again, we still want to take that into consideration. If there is any issues with blood flow, circulation, that's another thing. If someone has poor circulation in the body, typically we see it more so in the legs and the extremities. I typically would not, obviously because we just don't have good blood supply in that region. So that's usually when we'd stay away from areas of those. Okay. Does that make sense?
Yeah.
Any other questions? Anything I can answer?
Do you treat the adductor?
Yes, yep. Treat adductor injuries. So whether it be a strain or just overuse type injuries, definitely treat it.
Is this being paid for by? I mean, the insurance takes care of it too.
Yeah, so insurance here, it's not covered with insurance. Typically, the way we do it is obviously you have your evaluation because I have to see what's going on, what's happening, and then every session is self-pay. So say you were using your insurance for your physical therapy.
Yes.
It would be, you would still get your 30-minute like one-on-one session, but it would be the whole session dry needling. Okay, so you come for your regular PT visit,
Yes.
and then the next visit scheduled that week, just say, hey, I want to do this for my dry needle. Okay, but that would be the self-pay option. Okay. Right now, I don't think. Yeah, it's one of those where insurance companies won't typically reimburse for dry needling cases. From what my understanding. Good question though. Anything else? All right, Alex, I'm gonna use.
Do you have a level like level 1, level 2? What
So
level are
2,
you at your
yeah.
level?
So 3 would be more of your, like I said, usually TMJ, face, hands, feet, and things like that.
Okay.
So I don't have the level 3 certification in that regard. All right, I'm gonna move some of these things.
Do you actually have any body aches?
Let's go. I'm gonna have you. Do you have an undershirt on underneath this?
Yeah.
All right, I'm gonna have you take that shirt. All right, you okay going face down? So, of course, I'm gonna check any areas where you're coming in with your pain or symptoms. Typically, I'm gonna expose the area. I'll make sure draped properly and things like that. All right, so I'm gonna move the shirt down just a little bit. If anything hurts or is sore, let me know. I'm gonna start just in the neck area. If I feel, so the same thing is sometimes people, they don't really say, ouch, that hurts, where I'm pushing underneath the skin. However, I may feel a taut band and I may say, okay, I wanna target this area. So that's where I'll go to the source. And again, you may see a little bit of a twitch response, we might not. After that, have the person sit up, kind of reassess the area, say, hey, how does this feel? Make sure there's not too many symptoms afterwards. Like I said, light soreness, and then kind of send you on your way from there. I don't really have that session full 30 minutes of dry needling. I don't really have you doing exercises. We're just focusing on the needling during that session, but I may give you some homework to go home with, things that you can consider. All right, Alex, you ready? Okay, so he's mentioning a little bit of pain, kind of in the upper trap area. So kind of I'm gonna come back to this spot in a little bit, but I'm gonna wipe the skin off, grab my needle, insert the needle, and then we'll go from there, okay?
It's okay if I stand?
Absolutely, you guys can stand and come around the area if you want. Alright, so needle is it's in this enclosed in the casing, very, very thin. Alright, I'll show you again. Alright, so we're gonna come back to the spot. And just tell me again now. Alright, you ready? Alright, may feel a little pinch. Alright, so when I insert, you may feel just a little poke. It shouldn't be sharp at all. And then I'm gonna go a little bit deeper. Alright, so the needle's inside muscle now, but what do you feel so far, Alex? Nothing too much? So I'm gonna go a little bit deeper into the tissue. Okay, and I'll go to the area where person may be feeling it, or if I notice like a twitch response. Now, again, I can use a leave-in method where I just have Alex relax there. I can set it for about 10 minutes and then come back, or I can use a pistoning technique where I'm moving the needle up and down. So the pistoning technique, you okay, Alex? Would be if I'm here and I'm moving the needle up and down, okay? All right, I'm gonna take this out.
So how far in do you think you actually go?
So this, good question.
Maybe not, but.
So this needle that I'm using, 40 millimeter, depends on the area that I'm treating. So say if I'm in the glute area, I'm gonna use a larger needle. I may use like a 60 or 75. I think I have a 100 as well. Typically about a 75. Now I may go about half the distance with the needle. Very rare do I go like all the way with the needle, just so I know like depth where I'm at. So usually I'll go about half the distance with the needle. Evelyn, you're like. Alex,
So that's like an inch?
Yeah, so it depends on the
I'm trying
size.
to figure out how big the needle is, so.
Yeah, so I'll show you
Yeah,
here.
look at that.
So, can you see this?
Yeah, yeah.
Yeah.
So this is the top of it.
Yeah.
The bottom part is like right here. So, like you said, maybe an inch with this size needle.
Uh-huh.
Now, again, if it's longer, I may be like 2 inches, a little bit more. Again, that also depends on the size of the body part, right? Most of the time, most common practice, we're using like a 50 millimeter, 40 millimeter, depending on the size. It's not very often that we're using like a 75 or 100, unless we absolutely have to. Some clinicians, they just like using the larger ones, just experience-wise and stuff. I usually stay with it like a 50 size, and that's usually enough to get to where I'm trying to target.
Do you use some kind of, like when you go to the dentist, they put Novocaine?
No,
No, before
good
you
question.
poke the needle.
No, because again, with that, like, it's a very, very thin, and again, that initial insert, you really won't feel a whole lot. You really shouldn't feel much. Now, as I go deeper into the tissue,
Then you feel
yes,
it.
you may feel a little bit more. Some people describe it as deep pressure or like achiness. You've had before, correct?
Mm-hmm.
What's the best way you could describe with the needle when it's inside? What would you say?
You get the initial, but then it settles down,
Yes.
right? Like,
Yeah.
you know it's still there, but, yeah, it does settle down.
Yes.
Yeah.
And
Do some people get sick to their stomach or lose their bodily fluids?
good question. No, I haven't had that. However, sometimes we have what we call like an autonomic response, and if someone's never had needling before, it's basically where your body just starts to sweat, hands get really clammy. I have had that before, and again, we don't typically get dry needled or have needles in the body, so it's a new stimulus to the body.
Right.
So if our body's not used to that, it's like in this state of, oh my gosh, what's happening, which leads to that clammy hands, sweatiness, and things like that. If that happens, I usually back off, have you sit up a little bit, take some deep breaths. But I just don't do as much at that point. So I keep that in mind as well, but never have I had someone that like went into full panic mode or didn't like it at all. And like Donna was mentioning, when the needle's inserted, you know it's there, but the idea is to get the muscle to relax, get the tissue to calm down. And typically, again, with the leave-in method, you can allow that to just settle versus if I'm pistoning and moving it up and down, I'm finding a bunch of different areas. So of course you're gonna feel that needle a little bit more versus me just leaving it in one spot. Some people really love dry needling. They like what the feeling. Again, you get a soreness, almost like maybe if you worked out or something, you get a delayed onset, 24, 48 hours of soreness. And again, it's helpful, it's beneficial. So again, some people, I have had them just do dry needling alone, and they really enjoy that, or they have their own workout program, exercise program that they do, and we go about it that way. Any other questions that I can answer? Evelyn, you nervous?
No,
No,
just
okay.
thinking how to my knees and all the buttocks and
So we don't needle, obviously bones, we have bones all throughout the body. I'm not gonna needle, if I hit a bone, not the end of the world. However, we don't want to necessarily just keep needling at the bone because the needle is gonna get dull over time because it's hitting a hard surface. So if that's the case, if we do hit bone, most of the time, like if I'm doing somebody's rotator cuff and it goes into the shoulder, usually the scapula, it may hit the scapula, which is okay, but if that happens repeatedly, then I usually change the needle out because it'll get a little dull. But again, I'm not targeting bone, I'm not trying to needle bone, right? I'm trying to target the tissue. And so sometimes you know you go a little deep and you hit bone, but it's not the end of the world. Usually I tell people if I hit bone, I'm in a safe zone because I know I'm hitting a hard surface. Okay. If I'm in the lung field, that's the area where we have to be the most cautious because obviously our lungs sit there, our rib cage is there. We don't want to go too deep to the point where you know we cause more harm than good. So that's usually the main area where we're like we have to be very, very cautious. Where we're inserting the needle, the direction that we're inserting the needle, and things like that.
And you said you don't do hands, feet, or face?
Correct. They can be done. I just don't. Yeah. So some people, yes, they'll get it for TMJ symptoms.
Right,
They may have carpal tunnel symptoms or plantar fasciitis. Now we can treat plantar fasciitis with some people will have tightness in their calf, and so we can treat the calf area, or I can treat the calf area. Versus some people will go right into like the plantar fascia, the surface with the needles. I just don't do like the plantar fascia area. It would be more of the gastrosoleus calf area. Anything else?
Cool.
All right. If you guys have any other questions beyond today, I'll give you a card. Of course, some of you guys are here already. But just send an email, give us a call, and say, hey, I just had another question about this. All right, everyone signed in? Right.
Yes.
Okay. And then you should be.
He has a question.
Yes.
I don't have any pain, but the problem is like I'm sitting here, want to
Get up. It's hard for
I
him.
have this all the problem.
Yeah. So in your case,
No pain at all.
No
just
pain?
My balance and this one. So what do I need?
so a lot of yours would be muscle strengthening, balance exercises. It wouldn't just be, hey, let's do dry needling. It would be more of the strengthening aspect. Now, if you did start to get some pain, of course, yeah, we can think about that. But you know, dry needling, it does help with muscle activation as well. So we still could use it for that. But for you, I would say more so it would be strengthening, balance, walking, you know, retraining the body in that regard.
And you don't work on knees that already had replacements?
We work around, like
Yeah.
around. the
Well, I mean, I
tissue.
don't want my knees done, but
Yes.
I thought I read that somewhere.
Oh yeah, you can't. So not obviously where the hardware is and everything, but
Yeah.
muscles around it.
Okay.
You know, the tissue around it.
That's the only problem.
Just the standing up. Okay. All right. Thank you guys for coming.
Okay,
I
thank
appreciate
you.
it. And like I said, if you have any questions, then feel
Yeah.
free to ask. Okay. I'll grab some cards at the front too.
Yeah.
All right.
Thank you for